Hi, my name is Carrie, and today we're going to talk about a career field of choice. Do you know what you want out of your career? Well, I was finally able to see my dreams and bring them to reality. With all the different career choices that I have made throughout my life, I've used this knowledge to choose a career that meets my expectations, goals, lifestyle, and fits my personality. This has allowed me to find a career that is my lifelong passion and provides me with a sense of purpose and making a difference in others' lives. My career field research project has also helped me to decide which direction I wanted to go in life. It has affected my educational choices and my overall job satisfaction. There were four main career choices that I have considered: health service manager, clinical nurse specialist, an accountant, and food service manager. Only one career cluster has been able to hold my attention throughout the years and motivate me to improve my skills and increase my knowledge. I have researched all the job tasks, working conditions, required knowledge, hiring practices, employment outlook, and current job listings for these four career paths to determine my ideal fit. The health service manager is part of an ever-changing culture. It can make changes for the good for everybody, and the position not only includes medicine and treatments, but it also plays a political role, such as providing safe and quality care to the public. Its health service manager is responsible for budget planning, establishing rates for services, financial reporting, hiring, training, work schedules, communication between the board of directors and staff, risk management, patient care satisfaction, purchasing, acquiring new equipment, maintenance of inpatient rooms, cleanliness of the department, policy implementation, and maintaining computerized record system. It also implements educational programs for staff development, and you must have good decision-making skills, good communication skills, and able to handle staffing situations and step in when needed and demonstrate the knowledge of proficiency in patient care, diagnostic testing, medication administration, and clinical procedures. In order to hold this position, you must have a minimum of a bachelor's degree to enter the field, and it requires long hours with a wide range of working conditions. You're on your feet a long time, days, and you can work late nights, sometimes evenings, sometimes all nights. So it's important that if you're a prospective candidate for this, that you have certain criteria that helps with this role. You must have good communication skills. You have to enjoy being social, knowledgeable about the healthcare field. Strong leadership qualities, good judgment of character, good conflict resolution skills, open to new ideas, understanding of finances, and understanding of IT systems, and be able to be good at motivating staff. The median wage for health service manager in 2010, according to the U.S. Bureau Labor Statistics, was $84,270 annually. And it's expected to grow about 22% through 2020, which is faster than the average, and it'll create about 68,000 new positions. The hiring practices will become more stringent with caregiver background checks, credit checks, reference requirements, conducting interview with a panel, licensure requirements, and education requirements. So I decided to do a check within about 150 miles radius of my current location, and there were 4 job openings in Minnesota and Wisconsin. For the next career that I was considering, which is in the same cluster as the health service manager, was a clinical nurse specialist. It's another position within the health field that has interested me. It's a position that requires an individual to split their time between patient care, research, teaching, management, and consultations. A clinical nurse specialist, or CNS, works with the nursing staff to improve patient care. They also must hold a bachelor's degree at least in nursing, and then have a Master of Science in nursing with emphasis on clinical specialty, and must pass the National Nurses Licensing Exam and be a certified nurse specialist exam. The working conditions and physical demands vary according to the facility that you get hired within. The office settings can range from a single office to a shared space among co-workers. You're still on your feet a lot. You work with a lot of different providers and other staff members. You're responsible for training new staff, working in a classroom environment, speaking to large groups of people, writing new policies, and responsible to demonstrate nursing skills to staff. What interested me was I would be involved in every aspect of the medical unit, and it would allow me to enter a more specialized field and work closely with physicians, and I would develop care plans for patients, research new equipment that would be utilized in the unit. I would also be utilized as a resource for staff nurses. The hiring process will often involve a panel of individuals who the CNS would work with closely. And it's often more than one interview. It's more like a couple interviews. You'd probably first interview with maybe the department director, and then they would involve like the physicians that worked in that unit, the department manager, and maybe even the higher ups. And that would go over several times. They also may do written or oral exams in the interview, and so that you can explain how you use your knowledge and your education and your skills in the past. They may give scenarios to see how you handle certain situations. They also will do immunization checks, drug screens, credit checks, check your background. And I also found that the median wage for a CNS in 2010 was $64,690 annually. And this profession is also expected to grow 26% through 2020, which is faster than the average. And the current job listing between Minnesota and in Wisconsin was 4 positions. There was 3 in Minnesota and 1 in Wisconsin. The next job that I was looking into was more in the finance department, in the financial job cluster. This position was in accounting, which I have had some experience over the years. I worked for my brother who owns a clothing store, and I was mostly self-taught, but he started from the beginning and so did I, and we worked our way through it, and it was something that I always thought I might enjoy, but I find I do like the healthcare field. The accountant, though, their responsibilities include financial exams, complying with regulation, completing tax returns, inspecting accounting books, maintain financial records, assess financial operations, make recommendations for best practices, and they also help to increase revenue, profit, and reduce costs for an organization. There are 4 main types of an accountant. There's a public accountant, there's a management accountant, government accountants, and internal auditors. These positions require a bachelor's degree, but there are also exceptions where this may not be required. They sometimes require a background in science, in technology, engineering, and mathematics can help an individual break into this field. Many people opt to become a certified public accountant as it is increased in pay and it increases job opportunities. Most of the work is office type setting, requires meeting with people regarding their financial affairs, working more than 40 hours a week, and is often very sedentary. This job is appealing to individuals who like set routines and working with data, have clear lines of authority to follow, and they make many decisions that affect people's finances. They lead people in decision making and dealing with risks. The median wage for accountant was $62,850 a year, which is equivalent to a CNS position. The outlook for this position is that it is expected to grow between 10 and 19% through 2020, which is less than the CNS or the health service manager. As for the job being set around a routine schedule and procedures, I like variety, and I like to change up my day every day with different activities and kind of being able to think outside the box. I think it would be really hard for me to stay focused in this type of atmosphere. So currently there are 128 job listings in Wisconsin and 205 in Minnesota for an accounting position. There was also another position which I considered was food service manager, as I was a waitress, bar manager, hostess, and bartender after high school. I always thoroughly enjoyed meeting new people and being there to make someone's night enjoyable. This position is responsible for hiring, training of staff, supervision, budget planning, purchasing, inventory, planning menus, handle reservations, maintain customer service, and believe me, in the food industry, it's all about customer service. Serving foods, drinks, marketing, compliance with regulations, and maintaining the facility appearance. This position requires a certification or an Associates of Applied Science in Food and Beverage Management. This degree would include classes on hospitality, human resources, nutrition, menu planning, food service, sanitation, purchasing, financial accounting, and hospitality laws. This position is physically demanding. You're working maybe 12 to 15 hours a day. Weekends, holidays, and many times nights. It's shift work, so you have to be there around the clock usually. This work ranges from restaurants, bars, and restaurant kitchens, hotel restaurants. The working conditions are hot, noisy, stressful, and you need to be pretty physically fit as you're on your feet long hours. It requires a lot of bending, twisting, lifting. It's important as an individual to have good customer service skills, detail-oriented, leadership skills, managerial skills, organizational skills, and really good problem-solving skills, especially, when there's problems within the restaurant with staff and customers and things like that. The median wage for a food service manager was $48,000 a year, which is significantly lower than the 3 previous careers, which is kind of like one of the down points of it. The food service manager jobs are expected to decline by 3% through 2020, which means a loss of over 10,000 jobs. The long hours, working evenings, shift work, would allow a little time with my family and friends. And this would make it difficult for me to enjoy things in life or have events planned on weekends, as I would require to work almost every weekend, usually. There are currently 14 job listings in Minnesota and 12 in Wisconsin. After researching careers as a clinical nurse specialist, health service manager, food service manager, and accountant, I've compared the skills, education, the work environments, the physical demands, the pay scales, and employment to determine which career path would best suit me and my needs. My current position as a registered nurse, with my experience and enjoyment in this industry, has led me to believe that the health service manager or CNS position would be the best suited for me. I already have the medical experience. I know the healthcare industry and often work with managers and CNSs. And I already work with physicians. And I'm working towards my bachelor's now, and I've already completed my associate's degree in nursing. So these positions would allow me to utilize my current college education, continue to build my skills and my reputation in helping me to become financially sound. The healthcare field also allows me to make a difference in my life. It's the industry and patients' lives by being the best I can be, and it motivates me to learn as much as I can. Thank you.